So it's a Monday, let's get motivated. After a very dedicated career as a nursing sister, you might think a married mother of 2 daughters would just cherish some time off finally to relax with her husband and children, and of course the reward of a pension to sustain her. But instead, we're about to meet a woman who sees her whole community as her family in need, and who's chose rather to invest her skills, her money, her time, and her future in that extended family.
For some people, their 9 to 5 is more than just a job to get them by, but a calling that sees them going beyond their title. That is certainly the case with our Mandela Monday hero today, Olivia Pharo, a professional nurse with over 2 decades experience who left her previous job to start her own clinic. All of this to better service the community of Atlantis, who are in dire need of the service because of huge unemployment. More than 2 decades later, you decided to start your own clinic. What motivated you to do this?
My motivation was the community wasn't getting the service that they deserve to get, and there was an outpour of complaints. So I've decided to start my own clinic, so here we are.
Sister Pharo, what drew you to nursing as a career?
Nursing was never my first choice. I wanted to be a social worker. This was part of my mother's dream because she was a nurse. So she asked me to apply. At the time, there was 4 nursing colleges. I applied just to 1, and I was accepted. So that being said, I think I didn't choose nursing. Nursing chose me.
I believe that you used your own pension money to start this.
I've used my own pension money because I wanted to help the community. I didn't want to wait on any investor to chip in with money. So my pension money was available to me, and I wanted to help this community with it.
A lot of the community members here struggle with transport getting to the hospital. Do you provide some home visits?
We do dial a nurse based on past experiences where I saw people struggling to get their people to the hospital. So we've got this dial a nurse service between 8 and 6 from Monday to Friday, and dial a nurse service is pertaining to bedridden people.
What services do you provide to the community?
Our service is comprehensive. It's consultations, it's child health, it's women's health, it's occupational health and safety, it's mental health, it's health education. Health education is the backbone of primary health care. So we don't want people just to take pills. We need to educate people how to live better. Then we're doing wound care, we're doing our dial a nurse services, family planning, HIV and TB, and immunization.
I must say they're very professional and they're very good in the work that they do here for people in the community. And I think this was a very good thing that they opened this clinic here in this building near to other people. I think it's privilegeable for our people as a community because everybody doesn't have medical aid or can't afford expensive doctors' surgeries. So this makes it more convenient for our community.
Ik ga vandaag voor het treatment en omdat het verniet is gratis, is het een groot hulp voor mij. En ik werk voor EPW en ons het 'n 4 maanden contract gekry. So geld is 'n bietjie van 'n probleem en ons waardeer dit wat Suster Pharo vir ons doen hier in ons gemeenskappen. Die koste van per dag en daarom maak sy dit vir ons bekostigbaar en ons is so bly vir haar wat die deure hier oopgemaak het, die kliniek.
What are some of your future plans for the clinic?
My future plan for the clinic is definitely to attach other services to it, like for example a frail care. There's no frail care center in Atlantis, and it's a thing that we desperately needed. Within 3 years, hopefully, we will be there.
With her team of qualified nurses, administrative clerks, an assistant clerk and cleaner, Sister Pharo and her clinic are lighting the way for other communities to follow, and they can use your support.